think we could start, Bhargavi. Randeep will join us.
Okay, great. Namaskara, good evening and good morning to those of you who are joining us from across the world. So welcome to the second webinar in Tackling Air Pollution series being held as part of the 25th anniversary events of Environment Support Group. I am Bhargavi S. Rao, a trustee and a senior fellow at ESG. Urban air pollution is a serious worry in the country today and across the world, and the host of sources that contribute to this have only been escalating, causing serious health impacts, reducing life expectancy of people in the region here and across the world. And Indian cities today are distinguished regularly, featuring amongst the most polluted cities in the world. And assessing trends in air pollution, particularly in the context of the jurisprudence, a study revealed that about less than 8% of hearings were on urban air pollution at the National Green Tribunal here in India. And in fact, very few from the so-called non-attainment cities. Further, a few more cases that were heard were also those filed by the civil society or individuals affected directly by the localized incidences of pollution. So in this context, with the UN General Assembly passing this historic resolution declaring that everyone on the planet has a right to a healthy environment, including clean air, water, and a stable climate, and in the context of India, where the right to clean and healthy environment has been a fundamental right incorporated under the Article 21 through various judicial pronouncements, what are the questions that emerge are something we all need to think about, and these are particularly those that what does this indicate in the context of a right to clean environment itself, and how have countries responded to it, particularly with the article that Leo just shared with all of us, with the US backing and then rejoining, and how have other countries responded, and what are the additional provisions that will be incorporated, given that the air pollution data, which Sharad will soon share with us, is revealing very frightening scenarios. And how will cities such as Bengaluru that have signed up for the Paris Climate Change Accord acknowledge this in the succeeding action plans? To understand this and more, we have with us today a very highly accomplished panel of speakers, and it gives me great pleasure to introduce each one of them very briefly. Sharath Kutikunda is the recipient of the International Award from the American Geophysical Union for his work on making the causes of air pollution more understandable. He is only the second person from India to become a recipient of this award. He is a chemical engineer, an atmospheric scientist, a TED fellow, and founder of Urban Emissions India. His main research interest is air quality analysis and finding ways to bridge the gap between science and policy. He was a member of the India's AQI Formulation Committee in 2014 and WHO's Air Quality Guidelines Development Group 2016 to 20. He has a PhD in Chemical Engineering and Environmental Policy from the University of Iowa and a BTech in Chemical Engineering from IIT Kharagpur. Thank you so much, Sharath, for joining us, and we are waiting to hear you. We then have David R. Boyd, who was appointed as the UN Special Rapporteur on Human Rights and the Environment for a three-year term commencing August 1st, 2018. He's an Associate Professor of Law Policy and Sustainability at the University of British Columbia. Mr. Boyd has a PhD in Resource Management and Environmental Studies from UBC, a law degree from the University of Toronto, and a business degree from the University of Alberta. His career has included serving as the Executive Director of EcoJustice, appearing before the Supreme Court of Canada, and working as a Special Advisor on Sustainability for Canadian Prime Minister Paul Martin. He has advised many governments on environmental, constitutional, and human rights policy and co-chaired Vancouver's effort to become the world's greenest city by 2020. He is a member of the World Commission on Environmental Law, an expert advisor for the UN's Harmony with Nature initiative, and a member of ELAW, the Environmental Law Alliance worldwide. Mr. Boyd, also the author of 9 books and over 100 reports and articles on environmental law and policy, human rights, and constitutional law. His most recent books include The Rights of Nature, The Optimistic Environmentalist, Cleaner, Greener, Healthier, A Prescription for Stronger Canadian Environmental Laws and Policies, and The Environmental Rights Evolution, A Global Study of Constitutions, Human Rights, and the Environment. We also have Mr. Randeep Dev, who is an engineer. He has a master's degree in arts. He's from the IAS batch of 2006. His major achievements have been in the areas of developing sustainable cities with tech-based interventions in the health sector for patient tracking and bed facilities, particularly during the COVID pandemic. His efforts in ensuring the efficient use of online referral systems, cadaveric transplants, and other government schemes have been remarkable. And he has been one of the most accessible officer during the COVID times. Thank you, Mr. Randeep, for joining us. Chio Kling is the executive director of Third World Network, an international non-profit policy research and advocacy organization with its secretariat in Malaysia. She works on sustainable development issues with a focus on social justice and equity issues and the effects of globalization on developing countries. She has engaged actively with civil society groups and developing country government policy makers in the evolution of sustainable development principles and actions since 1992. The United Nations Conference on Environment and Development in Rio de Janeiro. She is also she's on the board of the International Women's Rights Action Watch Asia Pacific and the executive committee of the Sahabat Alam Malaysia, the Friends of the Earth Malaysia. And we also have my colleague Leo Saldana, who is a full-time coordinator and trustee of ESG. He has gained wide-ranging experience in the areas of environmental law and policy, decentralization, urban planning, and a variety of human rights and development-related issues. He's worked across many sectors for over a decade now. He's a keen campaigner on critical environmental and social justice issues and has guided several campaigns demanding evolution of progressive laws and effective action. So before we start, I would invite Leo to contextualize the right to clean environment in the Indian context briefly. And then we could start with Mr. Sharath Gundikuta, who will share with us some of the data, which will also help set the tone for the talk. Following that, we will request Mr. Randeep, because I know he has to leave by 6:45. And then we will have Dr. Boyd come in, and followed by Chio Kling. And then we could take question answers from the audience and also those watching us on Facebook. Thank you. Over to you, Leo.
Thank you, Bhargavi. And I just have to tell you that the long introduction you gave to me was unnecessary, because you and I have both worked to build this initiative along with our trustees and all our colleagues. And we feel really grateful to everyone who has worked with us. And all that we have accomplished has only been possible because people like David Boyd or Chio Kling or Randeep or Sharath have so readily stepped up and extended support. On that note, I just want to highlight a few aspects which, I mean, of course, the speakers will go into the depth of it, but the main key points that I would like to highlight is the fact that in India, we are ready to legislate. In fact, we rush to legislate. And we are even faster in terms of adopting various international treaties and ratifying them. So India has an impeccable record in terms of accepting and legalizing international laws into Indian jurisprudence. So it's not a single piece of law that we don't sign. If anything, the only contentious issue that we had fought for a very long time is the WTO agreement, but everything from Rio Declaration to CBD to the right to clean environment, healthy environment, and so on, India readily accepts. But if you look at the state of India's environment, obviously there's a huge gap between our legal intent and our regulatory practice. And this is not a new phenomenon. The simple truth that despite multiple warnings from pollution regulatory agencies, we allowed the Bhopal gas crime to happen in 1984. And since then, we have simply not fixed that serious risk. We have had so many different types of accidents, industrial accidents, which have killed thousands. However, our response to that has been almost rhetorical. It has never been substantive, meaningful, and real. We do also have an institutional infrastructure. We have a pollution control board network. We have health departments. We have, the environment department that functions, and the Ministry of Environment and Forests, an independent ministry which was set up in 1986 with the new law that came in. But the budgetary allocation to these are so marginal that it reveals the fact that our rhetoric does not also translate into real action through budgetary support. And the most recent budget, union budget, is yet another indicator of that. And yet, when we look at the world reality, that of the 7 million deaths due to air pollution, 1 million of them are in India. At least those are, I believe, conservative estimates. And of all these deaths, 99% of those who die due to air pollution live in what the WHO says is highly polluted atmosphere. And most of them live in industrial areas or cities. And look at our cities in India. They're expanding, they're getting more and more polluted, and more people are falling sick. And one of the indicators of that was during the pandemic, we just simply couldn't breathe. In fact, our lungs collapsed so easily. So is that an indicator that we, with all our institutional support systems and legislative intent, are simply incapable of comprehending how serious a problem air pollution is? Now, while that is the case, and I would think that this panel is the best to respond to that, another issue that comes up is the Supreme Court of India has repeatedly, in multiple cases, integrated the right to clean environment as part of the fundamental right. So it is enforceable right now. It's been like that for quite a while. But when you actually try to find case laws relating to punitive action against those who have violated this right, you hardly find any laws, any jurisprudence on that. So again, there you see there's a failure between rhetoric in the judgments of the Supreme Court and various high courts and actual effective implementation of that in terms of securing the rights for millions of people who suffer. So 1 million people dying of air pollution, my sense is maybe 100 million are suffering air pollution. We don't know the numbers. We are going to be the largest, the most populated country very soon, and also the most densely crowded. And it is a relative when I say densely crowded, because cities like Bangalore, Bombay, Delhi, Chennai, etc., will be so densely crowded that across the world you won't find comparative examples. So we really have a situation where, in responding to this crisis, we are not yet in a position to realize how serious the problem is. And our worry is that, and those of us who engage with this type of problem every day, we always worry, what are the tools, what are the mechanisms, how do we get our systems to realize, how do we get the the population at large to understand that this is not a trivial issue. If you look at all our parliamentary debates, in fact, the parliament never functioned this session by and large, or legislative debates, we hardly find any mention of air pollution as a serious concern, and yet it is the biggest killer. So I think on that note, I feel that it is our responsibility, yes, but it's also the responsibility of our legislators and the executive and judiciary to really push for serious action very soon. And what more an incentive than the fact that we now have a UN declaration which supports the right to an healthy environment. And David Boyd has been critical to that, and Chio Kling also has been involved in it, in bringing the kind of wider context to it. So on that note, I am really happy that all of you have agreed to come. I'm very happy so many people have joined. We also have it online on Facebook Live, being live streamed, and my colleagues Nidhi and Sachin are tweet reporting it from the ESG India handle on Twitter, and the backend is being taken care of by Amrita. I thank them all for really stepping up and putting it all together. So thank you.
Thank you, Leo. Sharad, the floor is yours.
Hi, thank you. I'll just share my screen. Okay.
Yeah.
Thank you, Leo. Thank you, Bhargavi, for giving this invitation. And so, what I will do is I'll set the stage on two different aspects. Sorry, one is general data, and the other one is on what kind of actions that are happening on the ground. Okay, so this is a picture of lung installations made by Asser Group. I'm just trying to move the videos here. The Asser Group is actually based in Bangalore, and the Lung Care Foundation. So they've been doing these installations in many cities, and this particular installation is from Delhi. And you can see that within 10 days, the installation just moves from white to black, basically showing the severity of the PM 2.5 and PM 10 pollution in the city. And they've done this in many cities, and pretty much all the cities get to this stage really quickly within 10 days. And there are some data that's coming in only from the big hospitals. This is from the AIMS hospital, looking at the outpatient counts and how that goes up really high, especially during the winter time, as the pollution levels start peaking in October, November, December. The number of cases registered in the wards just keep going up. There was even, in fact, one of the news articles had a post which says that Delhi has become the asthma capital. I think that's a little bit skewed, because we get more information out of Delhi on both on the air quality levels and also from the hospital admission information. That's one of the reasons why we end up not talking about Delhi a lot more. The same situation is probably true in a lot of other cities as well. So I'll quickly go over the information that we have on air quality and what we understand current situation, and also on some of the action plans. A quick look at the criteria pollutants. I mean, we have many criteria pollutants that are listed listed by the Central Pollution Control Board, but the most critical ones are obviously the PM and PM, the particulate matter, both fractions PM 2.5 and PM 10. But we are not very close to the WHO guidelines, which are benchmarks for health impacts. For PM 2.5, the new WHO guideline is 50 for annual average concentrations, but we maintain at 40. There is a new committee in place which is looking at trying to address the numbers. How low that will go, when we'll have to wait and see. Only for CO and ozone, we are at par with WHO guidelines, or even better than WHO guidelines. And we don't really exceed those pollutants that much. But in cities, we are now seeing ozone exceeding and even showing up in the air quality index once in a while. And of all the pollutants, PM is the most important one. And for the size fraction, PM 2.5 was introduced only in 2009, but not all cities still measure PM 2.5 as required. If we look at chemically, PM also is a very important pollutant because it has contributions from all the other gases as well. So this is one of the reasons why in India, if you look at any action plan or any discussion that's happening, pretty much everything revolves around PM. We did introduce the air quality index in 2014. It really changed the way the information was presented from the Minister of Environment to the public. Basically dumb it down to a little simple color code so people can understand. There are two things that really came out of that. So one is, it re-emphasized the fact that PM 2.5 and PM 10 are the main pollutants that we really have to worry about, because more than 95% of the time, the pollutant which is deciding the air quality index for the city based on whatever monitoring data is available is particulate matter. Only recently, NO2 and ozone are creeping up once in a while, but that it is really small. So another lesson that's really coming up is on the health severity. I mean, even though we say that, okay, well, 30% of the time or 40% of the time we are in the green zone, it's not really in a healthy environment when you start comparing it to the WHO guidelines, because even the air quality index that's formulated here is based on the India's air quality standards. So it's not really looking at the threshold values of health impact, it's looking at the standards that are implemented and followed in India. So the severity is really been undermined in these air quality index methodologies. But the methodology is there. It led to more awareness, and it's basically giving us a lot more information to play with. Generally speaking, we only talk about air quality in October, November, December, January types, when the pollution is really increasing pretty much across the country. This is a very rare opportunity to talk about air quality in April. So I really thank Leo and Bhargavi for putting this together, because we get more invitations to talk about air quality in the winter time than in the summertime. But generally, that really has to change. It doesn't mean that the air quality levels are better in April. We still have very high numbers, and we still hover around yellow and orange in a lot of places. And the story for air quality comes from two different angles. One is from the monitoring side itself, and another one is the modeling side. So quickly on the monitoring side, we get the question, do you do enough of monitoring in the cities? The quick answer is no. So as of end of last month, it's about 440 continuous monitoring stations are operational in the country. So these continuous monitoring stations are relaying information every 15 minutes, and then you can track it on CPCB's website. And we also have some manual stations, about 883 manual stations, which get only 1 point for 1 day. And for PM 2.5, PM10, SO2, and NO2, and those numbers are also used for air quality index calculations, and use that for awareness purposes. But ideally speaking, if we take the commercial density, vehicle density, population density, and a lot of other activities that are happening in the region, even the seasonal activities, if we take all that into consideration, we really need about 4,094 based on CPCB's own thumb rules. To spatially and temporarily represent what we're seeing seeing on the ground. So we're still a long way to go. One big factor that really comes in the picture is the cost. When we talk about a continuous monitoring station, it costs about 2 crores, and that's a lot of money, about 300,000 US dollars. But on top of that, you have maintenance costs and all that stuff. So it really brings down the need for innovations in this sector. And there are these low-cost sensors which are literally proliferating across the cities, but there is a lot of back and forth on the reliability and running them for a very long time. I mean, a lot of sensors that we are seeing now, after a lot of calibration, they work for barely 6 months or so, and then they need to be replaced or recalibrated, which takes a lot more time and money in getting them back on the platform. But if we look at beggars can't be choosers situation, when we do want to increase the amount of monitoring that's there, so we end up promoting more of these. But ideally speaking, we want some really good reference grid systems all over the place. So when the gap is so high in the monitoring side, the modeling side really comes into the picture, and it really helps us in building the story bottom up. And this is where a lot of work from Urban Emissions is involved with. So this is a quick look at a global chemical transport modeling system, which feeds a lot of the global burden of disease works. And it's a summary of that. If you compare 1998 and 2020, when we really have moved away from what used to be moderate and poor conditions in some parts of the country to poor and very poor conditions. So there's moderate, poor, and very poor conditions. We're referring to the air quality standard definitions that are there in Indian system. So we really moved more and more towards poor, very poor, severe hazardous zones. In the cities, it will be even more. And if you look at where the biggest changes have come, what we're seeing is south, which used to be really clean because of the land sea breeze on both sides of the peninsula and all that stuff, that's also kind of evaporating. We've seen almost like doubling of numbers in the south. And then we're seeing more of those increases coming in especially from the cities and the tier 2 and tier 3 cities going forward. So right now, about only 21 states at the state level averages comply with the national standard, but it's really low at the district level and city level. And if you translate the same information to population, we have a big drop in the amount of population which is actually complying with, a breathing air which is complying with the national standard. So in 1998, we had about 60% of the population which was complying with the national standard. It's now dropped to like 30%, which is complying with to that, and a lot of population which is like very severe conditions in more than 90 micrograms per meter cube, that has really increased. About 20% of the population is now actually breathing on an annual average level severe conditions. So like this, a lot of cities have stories, and they're all online on our websites. I really encourage you to go and take a look. I'll quickly go over to the action plans, and I want to focus particularly again on Delhi, where we have done a long-term review of what happened in Delhi and what kind of information is there available. One story that really comes up in a lot of places is that we invariably end up focusing on transport sector. And even in a place like Delhi, irrespective of how many studies that are done, and even the real-time monitoring, real-time source apportionment work that's coming out, this is posted every hour. There you will see that the transport sector is barely less than 20% of the contribution, but the transport sector gets a lot of importance, both in terms of the coverage, awareness, even in the action plans. So the quick summary of all the studies that were done in Delhi from the late 90s to up until last year, we see that there are a lot of sources which are in the same bucket as transport, especially when it comes to the percentages, but we don't give them as much importance. A lot of importance goes to the agricultural residue burning, which happens literally for like 2-3 weeks. Diwali firecrackers, which is a 2-day event. They take up so much media space and even general discussion space that the sectors which are really need a lot of ground action, they just wash away in the muck. Even in the National Clean Air Program, if you look at the action plans listed for Delhi, so we have a template like this for almost every, not almost every city, but every city which has submitted an approved action plan, we tabulated this. So in case of Delhi, transport gets 40% of the action items that are there are focusing on transport sector. Now, the household cooking and heating, which is a big chunk, again, close to 30% of the pollution comes from that, especially in the wintertime, it's even higher. It gets 2 points. So it really is a very severe sector inequality that plays out in the action plans. In general, Delhi has been on the receiving end. It gets better standards 2-3 years, of even 5 years before their release nationally. This is for fuel and vehicle standards, and we see it had some benefits over the years, but I think there will be larger benefits if we start looking at the problem nationwide altogether. A very specific intervention that happened in Delhi, it's a CNG conversion in the late 90s. There was it made a huge difference at that time, but then numbers have gone up after that. And recently we are seeing a drop in the overall averages, but we don't know whether this drop is actually coming from some activities that are happening in the city, or mainly because of increase in the total increase in the representation of the sampling sites that are in the city. So that debate is still kind of an ongoing exercise. So only in the last 4 or 5 years or so that we are seeing that the availability of data from the monitoring stations has really increased, and it's up to about 80%, which is a really comfortable mathematical number to play with. 40 stations with 80% of data, then we can actually build stories very confidently and tell now whether any of the interventions are working or not working. Like for example, this odd even experiment that was introduced in Delhi for 2 days, it depends on how you see it. Now, if you see it on an hourly basis, yes, there is a drop. But if you look at it on a daily basis, then no, there is no drop. So what happened there? So one of the theories is that the intervention was introduced for 8 a.m. to 8 p.m. So a lot of people started taking the traffic, getting onto the traffic lines after 8 p.m. So did it really help us on the long run? No, it's a big question. From a CO2 perspective, maybe it has made a big difference because the vehicles are moving efficiently, vehicle speeds have increased. So that there was a positive change on that perspective. One thing that came out of the COVID-19 lockdowns is a very emphatic point that we always keep saying, that if we really want change in air quality, if we want better air quality, then emissions have to reduce at all the sources. I mean, not just the transport sector. And I mean, that's the drop that we have seen in PM 2.5 and NO2 in those 2 months, April, May months, over the Delhi zone, and we have similar plots for pretty much every city that we can see, not only in India but across the country, across the world. So the one thing that really happened in those months is a lot of combustion has really taken out of the system for in some places weeks and some places months, and it made a very big positive difference. And then the message that we want to take it from that is that if we really want clean air, we really have to start reducing the emissions at the sources and not look at after everything is in the air already. This is almost the last slide. So the one thing which is really consistent in pretty much all the actions that have taken place in Delhi and also in other places as well is judicial interventions. So this is where one of the points that we would like to make is that it doesn't have to be the case. It doesn't have to be judicial intervention only to have better air quality. So right now, for example, CNG happened because Supreme Court said do it. Fireworks, there was a ban for sale of fireworks for multiple years during Diwali. Again, a NGT and Supreme Court intervention. BS6 originally was scheduled for 2025, but it was moved to 2020, again, because of Supreme Court intervention. They said do it, so it happened. Smog towers, it's the stupidest idea there is, but again, Supreme Court comes into the picture and says, put a smog tower because something has to be done. Pet coke ban, again, Supreme Court jumps in, NGT jumps in and says that, okay, pet coke is bad, so it has to be banned. I mean, these interventions doesn't have to be done after the judges come in and say that this has to be done. The scientists, the ministries can take proactive action because we know what is good and bad, and we know what works and what doesn't work. We've seen this in multiple places, and we can take proactive actions. So I would like to leave it at this and then open up afterwards. Thank you.
Thank you, Sharat, for walking us through all those numbers and also pinpointing the challenging areas. And the last slide spoke a lot about where the action is needed, and I'm sure all the participants will have a lot of questions. But since Mr. Randeep has to leave, we will give the floor to him and then get back to you with a lot of questions for sure. Thank you so much. Mr. Randeep, the floor is yours. You can
thank you. Thank you.
Yeah,
thank you. I don't have a presentation, unfortunately, but I just like to share some thoughts. I've shared a small note with Leo, something that I could just pen in the short time that was available. Of course, he gave me notice long time back, but because of the COVID scenario, we've really been tied with elections and COVID both coming together this time. So finding time is really difficult. But thank you again for having me in this elite panel. And I don't know how much I can contribute because I'm more an administrator. I'm not an expert on air pollution, nor do I claim to have done anything significant in that area. But of course, having seen administration from close, there is Leo has been asking the right questions. That where is the gap? I mean, is it a policy gap? Is it an implementation gap? Is it a gap that is more about understanding and then enforcing? Or is it because all of us are lax and we don't give it the priority that it requires? Do we feel that pollution is more an environmental, societal problem, something that does not affect individuals, where individual impact is not seen for us to rise? Probably that could be one of the reasons, because we see it as something at a distant. We do not see it as an immediate threat. But me being in the health department, I can see that how deeply it is affecting people. The number of cases that do come, upper respiratory tract illnesses, lung carcinoma cases. So these numbers are an eye opener for us, and I think as a health department representative, it is of immediate concern to me as to why environmental laws are not being able to be implemented on the ground to the extent that we may require them to. So I'll just be brief in my presentation, and I'll just talk about what is the regulation challenge basically being an administrator. We do see that the country has a rising economy and there is increased pressure on land resources. But can development be environment friendly, or is development antithetical to environment? Do we see this as two separate subsets which cannot coexist? I mean, that is a larger question that we need to ask, especially urban India, as we've seen Sharath, his slides, really an eye-opener in terms of how cities grapple today with the kind of vehicular pollution, with the deforestation, the increased industrial foot-stamp that is happening. Global warming is there for all of us to see. Higher suspended dust, we are seeing much more younger children afflicted with wheezing, asthmatic problems today in a city like Bangalore, which was earlier known for its pollen. Probably today it is facing the challenge of construction waste dust and suspended dust in the air. So this also reflects that the changing economy of a city or a state will also have a direct impact on all these respiratory illnesses. Now, when we look at new areas of Bangalore, having worked in the local body, I can say it is a tremendous challenge because the development is not very well regulated. While there are laws in place, bylaws in place, construction norms, they are not followed to the hilt. And while we may see this as being lax at one end, but the impact that it has on environment in the longer run, and the images of Bangalore getting flooded with just half an hour of downpour is for all to see. Across the world, these pictures are flashed. So we need to really ask ourselves, is our development in a regulated manner, or is it totally unregulated? Vehicular density is something that, again, a city like Bangalore, like Delhi, has to grapple with. The pace of common transportation systems like metro, really, can it catch up with the pace at which the city is growing and the needs? And do we have that last mile connectivity for telling people to shift to public transport rather than rather than just using their private vehicles for transport? We do not have a law like probably which Singapore does in terms of controlling the number of private vehicles that one can own or use on the road. But time will not be far when we start thinking in this direction. Electric public transport vehicles, yes, that's an option, but look at the large fleet that we have, be it buses or other kind of commercial vehicles. Fortunately, Bangalore city, I do not know the numbers, but I do not feel there may be a large level of household level pollution. Probably not industrial pollution like the other parts of Karnataka. But of course, we are seeing the ill effects of urbanizations, definitely. As I said, construction dust and the general dust, because most of a large part of the outer Bangalore, the roads are still not tarred to the right level. So we are going to see quite a lot of pollution there. What do legislations help us do? I mean, legislations help us put us on the right track. But at the end of the day, are these legislations acting as deterrents, or are they only looking at just probably talking about the polluter pay principle? You pay an amount and then you continue to pollute. How do we incentivize renewable energy? Is at a household level, at a commercial level, at a city level? So are we doing these things? I have worked in the waste sector. Bangalore's huge problem of urban waste. One of the solution mooted was the waste to energy plants, which involved incineration. So I could gauge that there were a lot of opposition. There was a lot of opposition from certain sectors, while certain sectors said that this is the solution ahead. So I think we need to debate these things in the open media, because there is a problem, but the solution should not become worse than the problem itself. And as Sharath had mentioned in his presentation, focusing on only one type of pollution will also not take us anywhere. So the source apportionment, as well as understanding what each city needs, and that is when the policy has to be customized for that city or state, and it needs to drive down to the last mile in terms of who the implementer is on the ground. Do we have, again, going back to waste management, we bought some kind of a control because we had what we called as these marshals who were on the ground, who went knocking on each doors, went to each of the shops and said that don't throw your waste on the streets. Now, do we have the same lines to catch the violence beat industries? So that is something we need to look at. On-ground enforcers, regulators, auditors, how do we get them on board? Yes, of course, we have the National Clean Air Program, but are we anywhere near the targets? Again, it is for the speakers here to tell that, is it realistic? Are we moving in the right direction? And if so, what is the gap that you feel that administrators like me need to enforce on the ground? Finally, as the health administrator, we have taken up a very small study. We are looking at the high AQI level areas, and we are doing a survey of those affected with respiratory diseases, primarily COPD, bronchial asthma, and to an extent, if anybody is affected by lung carcinoma. So this study, I'm sure, will throw up very interesting results. We would like to make this study also public, just to bring about this correlation, interrelation between the two, because we really have to bring out the shock factor for public to realize that this is an individual problem. This is an individual health problem and health concern. And that unless as individuals we all join hands and commit as a society subsequently that we need to abide by the norms and self-regulate at some level. We cannot have a policeman always knocking on our doors and saying abide. So if more regulation at one end, self-regulation again at the other end. So these are some of the challenges that the department is facing. Early screening for lung carcinoma again is a huge challenge because we don't have that many resources in the health department. But definitely once we drop this correlation, I'm sure there are a lot of documented pieces. Leo has been kind enough to share with me some documentation, which I will go through at leisure over the next week and see that what we can do from the health department to highlight this as something which is of not just fashionable to speak on forums like this or go ahead and go ahead and just write some books on it, but how do I bring it out and get in an actionable plan for which public can hold me accountable and say that, yes, look, these were the targets, measurable targets. These were the incentives and the disincentives to put in place. These were the enforcers on the ground. And did I achieve that? So I think unless we drill down to that level and have a lot of intersectoral coordination, because government is a mammoth body, unless we have the intersectoral coordination, I don't think we'll be in a position to go anywhere close to the AQI levels that are mandated and the main concerns of PM10 and PM2.5. So these would largely be my comments in this area. I will stay around for some more time. Some of the very eager to hear some of the speakers on what their perspective is. And please be frank and open in terms of what is expected from administrators like us, because at the end of the day, this is a problem that we all need to collectively solve, and the administrator is as responsible to address this challenge as anybody else. Thank you.
Thank you, Mr. Randeep, for sharing us the initiatives taken up by the department and also the challenges you are currently facing. Happy to know that some studies have been initiated, and I'm sure we will all look forward to reading it and understanding things better. So we will now move on to Professor Boyd. Dr. Boyd, the floor is yours. Over to you.
Great, thank you very much. I'm delighted to be here. It's very early in the morning here on the west coast of Canada, but as you said in your introduction, I was appointed as the UN Special Rapporteur in 2018, and the very first report that I submitted to the Human Rights Council was about this issue of clean air. And that's because none of my predecessors had done a report focused on air pollution, despite the fact that globally it is the problem that results in the greatest number of human deaths and illnesses. So when we look at air quality, and this is part of a broader part of work that Leo mentioned, which is recognition of the right, people's fundamental human right to live in a clean, healthy, and sustainable environment, something that has been recognized as implicit in Article 21 of India's constitution, dating back to the 1990s. But I do want to just follow up. Leo mentioned India's impeccable record in terms of recognizing international treaties and that sort of thing. When this first came to the UN Human Rights Council in 2021, there was a vote on whether the United Nations should recognize the right to a clean, healthy, and sustainable environment. 43 countries voted in favor of that resolution. 4 countries abstained. No countries voted against. But among the 4 countries that abstained were China, Russia, Japan, and India. I subsequently met with India's ambassador to the United Nations, who frankly could not explain to me why India had not supported that resolution. And just this week, there was another resolution at the UN Human Rights Council, and India was one of the leading voices arguing against international recognition of everyone's right to a clean, healthy, and sustainable environment. So I think that's a bit of a disturbing background that needs to be shared with people in India, that your government on the international stage is making arguments against the right to a healthy environment. Although these UN resolutions from the Human Rights Council in 2021 and the United Nations General Assembly in 2022, which India did vote for, by the way, at the General Assembly, the right to a clean, healthy, and sustainable environment is not a new human right. It has been around for decades. It was first coming up in constitutions in countries like Portugal, Slovenia, and Peru back in the 1970s. It was included in the African Charter on Human and People's Rights in 1981, the San Salvador Protocol on Human Rights in the Americas in 1988. And so we actually have decades of experience with the right to a healthy environment. And we know that it has both a bunch of procedural elements and a bunch of substantive elements. On the procedural side, that's people's access to information, public's right to participate in environmental decision-making, access to justice with effective remedies. And on the substantive side, of course, number 1, the right to breathe clean air. Number 2, access to safe and sufficient water. Number 3, access to healthy and sustainably produced food. Also, non-toxic environments where people can live, work, learn, and play. Healthy ecosystems and biodiversity. And finally, a safe, livable climate. And those elements have been reflected in legislation around the world, in court jurisprudence around the world, and are now clearly established. So in my report on clean air, I looked at this body of experience dating back 4 decades and was able to synthesize 7 specific steps that all states must take. These are human rights obligations when it comes to protecting people's human rights from air pollution. The first step, and it was very interesting to listen to Sarath's presentation because he touched on many of these points. The first of the 7 steps is monitoring air quality and the human health effects of air pollution. And it sounds like while there's been progress in India in terms of monitoring air quality, there's still more work to be done. The second step is assessing the sources of air pollution, which is a vital prerequisite for making policies that target the most important sources of pollution. And these source assessments have to be done on a city by city and region by region basis, because those will differ within the context of a large country like India. Number 3 is to engage and inform the public about air quality on a daily basis, about air quality in public education. And I was disturbed to hear that India's air quality, the public air quality advisories, which are based on, that the green to red, is based not on whether air quality is actually safe, but whether air quality is meeting India's air quality standards, which I'll come back to in a minute. So I think that's highly problematic if people are under the impression that the air they are breathing is safe, when in fact it is clearly, from a scientific perspective, not safe. So that's number 3. Number 4 is to enact legislation with standards that are based on science and international guidance from organizations like the World Health Organization and the United Nations Environment Program. And here obviously is a place where India's standards lag behind. The new WHO guidelines for fine particulate matter, the annual average recommended by the WHO is 5, and yet India's air quality standard for the annual average is 40. So that's a huge gap. And then the 5th step is to have action plans at the national, regional, and local levels that articulate the specific actions and measures that will be taken to improve air quality. And so again, this connects back to the earlier step of source assessment. When you have industrial air pollution as the primary source, then that should be the primary priority in reducing air pollution. If transportation, industrial sources, and household air pollution are all equally major sources, then actions have to be taken to address all of those primary sources of pollution. The 6th basic step is the implementation of those actions and the enforcement of air quality standards. And then the 7th step is evaluating progress. And if progress is not adequate in meeting the standards, then additional measures and actions have to be taken. And as I just really want to drive home the point that these are not obligations. Governments at all levels cannot consider these to be part of a suite of possible actions, but these are 7 obligations that governments can be held to. And another thing I've done in my role as the UN Special Rapporteur is I've assisted local community-based organizations in using this human rights law to hold their governments accountable to improve air quality. So for example, in Indonesia, I filed an amicus curiae, or friend of the court brief, outlining these 7 steps that governments must take, submitted that to the courts in Indonesia as part of a case that was brought based on people's constitutional right to a healthy environment. And both the trial court and the Court of Appeal looked at those 7 steps and said, yes, these are human rights obligations that governments must follow. And so the Indonesian court has ordered all levels of government in Indonesia to take steps to improve air quality in Jakarta. A similar case that I was involved in South Africa, again, 2 local environmental justice organizations filed a lawsuit arguing that the government's failure to address pollution from coal-fired power plants and coal mines in the Mpumalanga region of South Africa violated their constitutional right to a healthy environment. And again, the court in South Africa found a violation of the right and ordered the government to bring in effective regulations within 1 year to improve air quality in that region. We're waiting for a very important decision from the Inter-American Court of Human Rights in an air pollution case in Peru involving lead pollution from a smelter. And I expect that decision will give some very clear guidance again on what states' obligations are. I think it's really important to emphasize that air pollution is a preventable problem. We are well aware of what the solutions are, whether in the household context, that's moving to clean cook stoves and clean fuels. In the industrial context, moving to best available technology standards. And I think it's really important for India, that has struggled for so long with air pollution, to look at China, because China, 10 years ago, China had air pollution problems on par with India, but China has made extraordinary strides in the last decade in improving air quality. At the national level, the government of China is reporting decreases in fine particulate matter between 30 and 40% at the national level over the past decade because of strong regulations and, critically, the implementation of those regulations. So I think there are some lessons to be learned from the Chinese experience. And the final thing that I want to say is that we can talk about more than 1 million people in India dying every year from air pollution, which is absolutely a tragic number. But the reality is that the human brain is not wired to be able to understand that. There's an American academic who wrote a paper with the very disturbing title of "The More Who Die, the Less We Care." And I think something that we can do to bring the public on board to support more ambitious action for air pollution is to put a human face on this problem. And so I tell the story of in England, there was this young girl by the name of Ella Kissy DeBra, whom some of you may have heard of. She was the first person in the world. She was a 9-year-old kid who lived in London, England, but she lived in a poor part of London where transportation was creating significant spikes in air quality. This kid who loved swimming and dancing, she developed asthma at the age of 7, and it became very severe. And every time there was a spike in local air pollution, she would have an asthma attack. And so 28 times she was taken to hospital to be resuscitated from these severe asthma attacks. And on the 29th time, at the age of 9, Ella Kissy DeBra died. And her mother was, as you can imagine, brokenhearted and fought to have a coroner's inquiry into Ella's death. That coroner's inquiry concluded that air pollution was a cause of Ella Kissy DeBra's death. The first, to my knowledge, the first case in the world where air pollution was specifically identified as a cause of a specific individual's death. We know that from the epidemiological evidence that 1 million people die, that 7 million people die globally, but Ella's face is now the face of a campaign in the United Kingdom for a law that would require the UK government to recognize the right to breathe clean air, something the UK government has fought against for decades, and would require the UK government to bring in those World Health Organization standards for air quality. That law, which is called the Clean Air Human Rights Act, also known as Ella's Law, has been passed by the House of Lords and is now at second reading in the House of Commons in the UK. And this is an incredible story because it shows the power of putting a human face on air pollution. So thank you to ESG for the incredible work that you're doing in India. Thank you to all of you for working to try and fulfill people's right to breathe clean air and to live in a clean, healthy, and sustainable environment. It's a pleasure to have allies like you. So thank you very much.
Thank you. Thank you, Dr. Boyd, for those very insightful points that you made. Hope you can stay with us a few minutes more. We'll also have Chokling speak to us, and then we could take some questions. Over to you, Chokling.
Thank you so much. I just wanted to pick up from where David left off. I actually lived in Beijing for about 11 years, and I actually totally agree with what you said. I arrived there in 2006, and it was like just before winter. And it was amazing. I mean, the cold, you could breathe the sulfur, you could actually feel the PM, getting into your lungs. And I had the most horrible cough. So I went to see the doctor after about maybe 3 months. The first thing he asked me was, is this your first winter in Beijing? And it's called the Beijing cough because it was so bad that I actually strained my rib muscles. I want to show the example because, within that 10 years that I actually lived in Beijing, exactly what David just said about, in the end, it is just the very air that we breathe or cannot breathe. So I think one of the important things was to phase out the burning of coal cakes because the poorer communities in the city were relying on burning coal cakes. And that meant you had to have a policy where you would subsidize electricity, to a very, very high level, almost free. And then you have to implement it. But it really did make a difference because acid rain moving out of the territory of China into other parts of East Asia was a huge, cross-border problem as well. But it does take a lot of not just political will, regulation, and enforcement, but also resources. Because at the 7 steps that David mentioned, requires a lot of resources. I mean, as a law student, I was very inspired by India's constitution and the judicial activism of India. But just listening, to what was shared tonight, and over the years, the sheer scale of challenge in terms of what we need to do, and I think a lot of the contradictions lie in I think what Dr. Sarath and also I think Commissioner Randeep talked about, when we talk about development and urbanization, the planning is so piecemeal that we keep making the wrong trade-offs. So I just wanted to highlight, at least from the civil society perspective, the human rights approach has always been very, very important. And I think the dilemma in our engagement with governments and I would distinguish between the implementers and the administrators and the enforcement on the ground people and the politicians who make those decisions when they negotiate. And I think this is the complexity I wanted to highlight a little bit tonight, because as somebody from a civil society organization that works a lot at the local and national level, fighting for the right to clean air and many, many other rights. And then we go into the international arena, whether it's the Human Rights Council fighting over, recognizing a resolution, or going to the climate negotiations where the whole issue of international sharing of, equitably sharing of burden, historical responsibility of who caused accumulation of the global warming gases. So I think a lot of our countries in the developing world and big countries like India and China, and this is perhaps one possible explanation, David, why in the human rights context there is this kind of reservation of not supporting the right to clean air, for example, or the resolution to implement it, because we are also at the same moment in the international arena fighting over a denial from developed countries of their own historical responsibility, or the fact that they have the technology and the resources committed under legal treaties like the Climate Convention and Paris Agreement to support as international cooperation, the move away from this very polluting forms of development. And that means of implementation across the United Nations has been not fulfilled in the last 40 to 50 years. I think that politics actually then interferes with the positions that many of our governments take at the international arena, which makes it very difficult when we want to really develop the jurisprudence of human rights, international law, that is so obvious. And so even when the United States objected at first to the latest resolution, why? Because many of these countries fear that if you recognize a strong right at the international level, citizens will take that right, go home, go to parliament, go to the courts, and ask for that to be enforced nationally. And we've had a lot of jurisprudence, as you said correctly in your report on clean air. When even climate change, we have two very important cases in the Netherlands and I think the UK, where groups have taken the treaty obligations there. And we in civil society put a lot of value in the resolutions of the UN, because it is actually accumulating into customary international law. And I think we need to, just as we need to bring the scientific data to the public in a very digestible way, I think we need to bring the right to clean air, the right to healthy food, the right to safe soils to plant that healthy food. We need to bring those rights into also the everyday lives of human beings. And we are not talking, especially in the case of India, of not having the experience of human rights, because it's very strong in the Indian kind of psyche and history and jurisprudence. So how do we actually bring a comfort level to our government so that the contradictions we see in the positions they take, and we probably will see more countries taking what appears to be a negative position internationally, precisely because of the geopolitics internationally, and because they are failing at the national level to fulfill all those human rights, including the right to clean air, and they just want to put a wall. So I think for us, how to overcome that would be really important. I just want to also touch on what has been brought up, I think, by a number of the speakers. We also have to look at the power structure in our society. When we look at the sources of pollution, some of the most influential lobbies are the big industries. The big industries, capture a lot of our political space in decision making. They fund our politicians, and the more we see corporate capture at the national level, the more we see corporate capture at the United Nations level, because it's a reflection at the international level of what happens at the national level. And the more you look at the fossil fuel industry, and how they function, and you look at the big agribusiness and the kind of agriculture that they promote, which actually is very polluting, right? So the pushing back of corporate power that actually pushes back on better standards of clean air regulations and all other human rights implementation has to be also recognized. So one of the things I wanted to point out is, which is very interesting, because the Human Rights Council itself is really the space where we have had this many years of negotiations on a legally binding instrument on the responsibilities of corporations, business and human rights. And that really would be a major achievement, because it is if it goes through, it is going to put responsibility and accountability and liability on the cross-border operations of companies. And I think that's something that's really important that we would like to see happen. Polluter pays. Polluter pays has also been so distorted. So polluter pays and continues polluting. That's not what we want. That's not what we want. And we need to bring the principle back. I mean, Bhopal was raised in the concept note that Leo had sent out. You know, it is still an unresolved human rights violation, right? And across, you know, we see many of these cases. So the real polluter never pays. So we need to really bring that back and the integrity of the principle in human rights law. Equity and social justice is so important, because if we put everybody as the same source of the problem, then we actually will put always inevitably the burden on the poor and the marginalized. The disaggregated and disproportionate impacts of air pollution falls very differently on vulnerable populations and marginalized populations. Women, you know, people who are disabled, who cannot move, people who are poor, who have no choice but to live in polluted areas. You know, so that kind of internal equity, social justice issues are part of the big challenge that governments have to deal with, city governments have to deal with. And I think that it's so daunting that sometimes it is just allowed to get worse. So for me, the big challenge is, how do we, as citizens, actually work together so that we strengthen the public responses, because we have a lot of civil servants across all our countries, and I hear some of them tonight, who are so dedicated, and you are collecting so much data, never enough, but so much more than many other countries. But what do we do with the data? How can citizens actually be more empowered to use that data, work with our allies in government across the board for what we need to do together? I think that some of the things that, David, you mentioned about what you can do as a special rapporteur, and there's a list of, when I look at the mandate of every one of the special rapporteur of the United Nations, including yours as the one for environment, you go in, you can study, you can conduct studies, you can do reports, you can investigate, and some of the things you just shared with us on the right to clean air are exactly the kind of things that more and more civil society groups are saying. We would like to invite all the special rapporteurs to come into our countries, not as an antagonistic way to our governments, but to work together. And I think that will be a good challenge. And how do we actually work with all the different rapporteurs? Because air pollution contaminates our soil, right? The precipitation contaminates our water. It makes a lot of farmlands also not able to be used for growing crops. So the interlinkages means that the special rapporteur on the right to food, the special rapporteur dealing with, waste and hazardous. So how do we at the UN level also get the different rapporteurs coming together? Because the problem of air pollution is also linked to so many other things, and that perhaps will strengthen us to get to the source. So I think I'll just stop there. Just wanted to, I didn't show my slides because listening to the other panelists, I just wanted to add some of my thoughts to what we could probably do together. So thank you very much.
Thank you, Cheo Kling, for those, again, very, very insightful thoughts of the role of civil society, government, data, and what actions can be taken. So we now open the floor for question answers, and those of you who want to raise a question yourself, please raise your hand and we can allow you to speak, or type in your question in the chat box and we'll be happy to take it.
Bhargavi, could I just ask a question?
Yeah, Leo.
David is also leaving, and I know.
Yeah.
It's probably left already because he had a meeting. Yeah, he's there still. Yeah, the point is this, and I think it helps to. There's a paper written by Mr. Sheila Jasanoff. She'll be speaking in a couple of weeks in ESG's 25th, anniversary. We're just setting up a 2-day event, and she'll be a key speaker. She'll deliver the keynote speaker. 20 years ago, at the cusp, at the turn of the 20th to the 21st century, in a paper she wrote, what the challenge really is finding common ground. And she phrased it this way: across ideological and political minefields. Now we have already seen the pushback by the United States, and I'm sort of not surprised that the current Indian administration has actually not supported these major resolutions in the United Nations. But the real situation is that while the IPCC has given us so much evidence of how precarious the conditions are across the world and how serious the challenge is and how we need to respond immediately, we are really relying on unwilling governments. So what is the direction we need to take, or what are the actions that communities and people's organizations and as well state governments can take, because in a federated system that can work, so that we can actually build secure futures. I don't know if David and from your experience, you can share how you meet this challenge in the current atmosphere of the United Nations.
Yeah, I think it's a difficult challenge that you've put your finger on. And I think that when you have a national government that's not willing to, make progress, then you need to change the government. And at the same time, work with state and local governments that are, local governments have control over so many issues that are related to the environment and people's well-being, whether that's local sources of air pollution or drinking water or wastewater treatment. So really targeting your efforts towards governments that are receptive to those messages, while at the same time building the national movements that can generate enough political power to force change at the national level. So I think it's really a challenging thing to do in a country like India, where you have that national government in place right now that is not friendly to some of these critical environmental and human rights issues. But governments do change. And so, we if you look at the United States under former President Trump, that country was an absolute disaster on all human rights and environmental issues. They're much better now under President Biden. So governments come and go. And I think that really fundamentally important, something that we haven't talked about that much today, is the fundamental importance of education and ensuring that environmental education is a part of the curriculum at every level, from preschool right through to high school, right through to university, so that everybody has an understanding of the problems and the solutions to those problems, and the critical importance, the urgency of taking action. We're living in a world that is coming apart at the seams because of excessive human pressures on the ecological systems that we depend on to generate clean air, to generate clean water, to maintain a safe climate. And so action is needed at every level in every country on an urgent basis.
Thank you.
Thank you, Dr. Boyd. Mr. Rajgopalan, would you like to ask your question? Please go ahead.
Thanks, Bhargavi. Really quick, the question is to Sarath, and if you could, I don't know if you're behind this, but it's very interesting. I find this AQI and other data splattered across a little widget on most news portals, and that's a very interesting trend that I've seen a little bit over the last 3 to 4 years. I don't know if you can shed light on this. The question is, how do we get individuals to pay attention to it, and what are they supposed to do with that data? So how do we send, I mean, there are various levels of alarm, and of course now my Google info pop-up also shows up on my mobile. So India's got over 700 million smartphone users, I believe, at last count, and we're probably as data rich as we can get from a mobile phone standpoint. So the question is, what do I do? See, when I get up every morning, I don't lead my life based on the AQI data. Should I be, or should individuals be? And what can we do to kind of lever that and send a message? So I'll pause there. Thank you.
Hi, thank you. I think the AQI data that's being posted on at least on the Indian newspapers, comes from the AQI bulletin that is released at 8 p.m. by Central Pollution Control Board every day. That's online, and it basically is, again, it's 1 point, and of the 200 cities, 120 cities have only one station. In any mathematical world, it's not a representative sample to say what the air quality is in the city. But right now, that is what's available, and that's what they're using to come up with a color code and post it up. Ideally speaking, if this air quality index information was generated using a representative sample of information, either coming from the monitoring data or modeling data, that can be used as health alert and pollution alert systems, and which is very actively used in some cities very effectively. Like for example, in Paris, they do the same thing. They release the air quality index, but at the same time, they also release the air quality index for next 2 or 3 cities officially. And if they find that day after tomorrow, let's say Saturday, they're going to see a big spike in the air quality index, and it's going to be severe, and it's going to happen because of ozone is going to spike. So they actually take measures to make sure that that event doesn't happen. Because they're relying on a very wide network of monitoring data, and they're relying on a very wide understanding of bottom-up emissions, where they are, where the activity numbers are, and things like that. They basically say that, okay, in this zone, we're going to cordon off the traffic, and for like all of tomorrow, we want to limit the number of cars or trucks passing through that area to 10% of what it normally is, so that the event on Saturday doesn't happen. So here there are 2 very important things that we have to keep in mind. One is having that kind of data management power for the organization to understand the reality. 2, have that kind of enforcement power, because we are trying to push an agenda or push a action which has to be implemented in less than 24 hours. Cordon off certain amount of traffic so that event on Saturday doesn't happen. So there is, again, those both of them have to happen. We really need to, in Indian cities, we really need to jack up our monitoring data availability, monitoring data capacity, and data availability, so that we get to a stage where we can make these decisions. So right now, we have a theory in place, and we have a concept in place saying that if we have this kind of information, we can make certain decisions. Like what you're saying, if I look at the air quality index, can I make a decision? Oh, should I go out now, or should I wait for a couple of hours and then go out, so that my exposure rates are less?
Thank you, Sharad. Krishnamoni, is your query clarified with the answer that I see in the chat box, or would you like to speak a little bit more about it? Okay, Professor Satyanarayana, please go ahead.
Yeah. So I am a retired associate professor from Tamil Nadu. Actually, I was there in the curriculum framing all this for 30 years. See, unfortunately, we have in the curriculum, the environmental education as a one paper, but unfortunately, the educators or the teachers who teach this subject, they're not aware of this subject, because history and Tamil has come because of the lack of the manpower, lack of the teaching community. We are forced to take the class. So this is one unfortunate thing, though the University Grants Commission insists that it's a mandatory to have all the environmental course. This is the one unfortunate thing which I observed. And the other thing is that, as Boyd rightly pointed out, the environmental education at school level, college level, we are not much given emphasis for at the curriculum level.
Yeah.
They have 1 or 2 topics in the your curriculum. So what we have to do is they're illegal. I say again, the existing laws, regulations, we ignore. See, if you see in India, most of us ignore the laws, and not only for environment, all the laws we ignore. We are not aware of the existing laws and rules. This is also one of the reasons at the school and college curriculum, we should have a chapters on the laws, existing laws, whether it is on the environment or whatever the animal welfare. So these are things, my observation, and maybe throw up for the experts to comment on this.
Yeah, anybody would like to respond to that? Shokling, Sharad. Yeah, please go ahead. Yeah.
No, this is very interesting, because just 2 weeks ago, the Clean Air Collective had a gathering in Bangalore, and almost every panel made exactly the same point on this environmental education part. And not just, like, for example, when we talk about environmental education for students, we are talking about very deeper understanding of how do I operate this equipment, or how do I run this model, what do I get out of it, how do I do the analytics and things like that. But also at the very basic I mean, you can call it a starter kit on what is air pollution, what are these different pollutants, how are these going to affect the health. If I get some information from these instruments, how do I know that this data is making sense or doesn't make sense? When we talk about the buzzwords, like, oh, we have to do the source apportionment, but like, what is the source apportionment? Things like these, especially for people who will go into the public domain and make I'm thinking of the word noise, but they're the ones who are going to make some. They write the articles. They'll make up some stories, and then they try to take the scientific information and then pass it on to general public in a way that they'll understand. So this part of that environmental education is also very much missing. And if you think of some NGO groups who are doing a lot of groundwork, but they lack that basic understanding in the back to be more emphatic in explaining to them that, look, when you have to stop burning wood in the stove because these are the kind of impacts, or these are the kind of chemicals that you're breathing. So just that basic jargon, I think that has to be like pushed down the line so that those groups also are a lot more active. So environmental education at the schools, yes, and universities, yes, but also at this level of engagers is also very much missing in India.
May I just add one point here, Bhargavi?
Yeah, sure, Leo, go ahead.
It's a Supreme Court ruling going back to 1997, if I'm not mistaken, which MC Mehta got, and in which the Supreme Court had directed every local government to invest a certain amount of money on environmental education, recognizing that without building awareness across the board and in a deep sense through these structures of learning, is almost impossible to respond to the complex challenges that environmental problems are. Now, that said, we are 30, 40 years later, what has turned out is that most of our awareness of environment is, as Rajgopalan rightly pointed out, in terms of beaming the impact of the problem. It's so bad, it's getting worse. So it kind of puts you in a disempowering state. It doesn't really build the type of skill sets and the awareness to transform and change ways and organize and collectivize and change collective behavior. So for those who can afford it, they'll go and install scrubbers and have rooms, safe rooms, and so on, and put AC systems, etc. But 95% of the people cannot afford that. So I think we're really looking at a very big catastrophic challenge here, and we don't yet have acknowledgement of the seriousness with which such efforts need to be prioritized. So here I allude to what David said, that if you cannot actually make that a priority, then how are you going to actually have the objective that is being set out at a national clean air program level? So on that note, I actually wanted to ask Chiokling if she could also look at some of the mechanisms that movements, networks have engaged with over the last several decades, and how she relates to the ways in which one needs to really engage with the scale and depth of this problem, and whether those techniques work. I do see what David said, that sometimes when governments don't work, it is our responsibility to make a government that works come for us. That's the whole point of democracy. But that's a huge political problem here. What are the other techniques that we can utilize to make sure people do get the right to healthy environment?
Yeah, Leo, I think before Chiokling speaks, I think David will be leaving. On behalf of everybody here who have participated, and also on behalf of everybody in ESG, we would like to thank David for his valuable input into this webinar and his time and effort. Thank you so much, David. It was great having you speak on this webinar. Moving on, Chiokling, I would also like to add the point that in addition to educational institutions not taking up this issue seriously, there is also a lax in the context of the local governments. Because while today Bangalore is segregating, at least some parts of Bangalore are segregating waste, we also see that, large amounts of waste land up burning here and there. And people also use it as a fuel into their little stoves in construction areas. So there is no education or simple ways in which the local municipalities can convey that message. So yeah, adding to Leo's question was that. Over to you.
Thank you very much. I think when we actually frame it as the individual responsibility, I mean, obviously there is an individual action that has to be taken, but I think for the majority of the population, especially for those who are in the poorer parts of our society, and especially those in the urban poor, they don't really have a choice. So when we say don't use a polluting source of fuel, what option are we giving to them that is affordable, that is accessible? So at one level, it's like saying, consumption and lifestyle is a big problem driving, unsustainable, development. But if we don't look at it as also a structural problem that needs fixing, and then we say it's up to the individuals to make those choices, I think then it is not enough, right? So I just want to make that general point. Now, the education part, it is not only in India that we are having this dilemma. I think it's across all over the world, not just in the poorer countries or developing world, but also in the wealthy countries, because education has moved so far as a whole away from the public values about commons, about, and if teachers are not equipped to teach, it's because they are the product of an education system that didn't, prepare teachers to be able to have that kind of thinking and mindset, on environment or human rights. And then, so even if you have an intervention from a Supreme Court decision to order people to do it, and this is the biggest problem with, challenge with education. If we have, and all of us have over, at least 2 or 3 generations not invested in teachers or nurses, then we are now reaping really the results of that lack of public investment. So we also need to train and retrain, the educators, and that's massive because but we have to acknowledge that as well, because a lot of teachers thrown into saying, here's a curriculum, they will know what to do. I think somebody did mention that just now. So that's so for the education point of view, that more sort of systemic approach needs to be taken. Now, what can we do? I mean, meanwhile, we just can't say, we don't want to be disempowered either. So I think a lot of, when it comes to, back to our topic on data, this came out again in COVID. What is the source of information, especially data that is reliable? That is very, very important because, and how that data, what is the context of the data? If the data you are giving is according to a low standard, then you say things are fine, right? But it is not a medical or scientific indicator or a WHO standard. I think we have that even in Malaysia. There's a lot of public skepticism about the pollution level data on PM, because we say it's like, first of all, where is your monitoring station? and what standard are you judging it by when you put a green or a yellow or a red, right? So when the public does not have confidence in the reliability of the data, they're not going to listen even if it's true. And I think social media is both so powerful, but also so problematic, because things get viralized so quickly, right? And it's just a big challenge. All of us who are not just the civil society groups, but educators, journalists, to take something technical and translate it to something that can educate and move people to do things and to pressure to get governments to do things is not easy. But I think we do have a lot of experience. I'm generalizing now, but I think we need to actually do more of that. And sometimes we fail, but we need to know. And I think for us, the challenge as civil society, NGOs and all that, we have to recognize the need for intellectual rigor. We have to look at research papers. We have to also know reliability of sources. And this is why we talk about when we have gaps in knowledge, we have to acknowledge scientists and all of us. So we cannot be so certain when we say we don't know. But don't know means under the precautionary principle for environmental care, when you don't know, you become more careful. You don't move and do things and do projects or whatever, right? If you have doubts, you take care, because if you do it damage and then later on you can't clean up the environment. But there are many things that can be done, and I think a lot of it has to do with who our politicians are beholden to. if you have very strong forces for, many countries, and India is one good example, you privatize so much that a lot of the influence on policy making has shifted, like many of our countries, to very strong companies, right? So the polluters have become really the rule makers. And I think we need to counter that with more public pressure. Not easy, but we have to keep doing that. That's what we do, I think, educators. And a lot of activists, academics are now very much into these movements. And local governments are so important. I think in every country, we know that the local governments are the ones closest to the people and to the environment that they are responsible for. And I think we don't pay enough attention to working with our local governments. And the other thing we need to do across Asia is that we just don't question as policymakers or even as society this inevitability of urbanization, because urban centers are very, very environmentally unsustainable. And we see, what happens, Delhi or Shanghai or, even our little city of Kuala Lumpur, because we are so bad at planning. And then, every time it rains for half an hour, we do get floods, as you do in Bangalore, which is ridiculous. So we need to, and those are big issues, but I think it comes to a point it's unlivable. People will, if they know it's a matter of rights, and back to the link to the human right issue, I think we need to educate that the right means that we have a right to make those calls and demands. And how do we work together? I think it's all about working together, sharing good experiences, and working with those UN rapporteurs, because they can do many things. They can come in, they can help us put together a report. All the data and research you do, if it translates into a country report by David Boyd, whatever our governments say, they do actually have a moral sort of compass that because they are still part of the UN unless they walk out of it. Sorry, long kind of answer to very difficult questions. Thank you.
No, thank you. That was really helpful. I see Kirti's hand up, but in the meantime, there's also a question by Krishnamoni, which says, what is the cheapest way to avoid air pollutants as an individual? So in our last webinar, we had Dr. Kashinath Dixit, who did address this to some extent. I would urge you to either read the report or go through the webinar, which is on our website. But he basically suggested things like, masking up, having a lot of greenery in your home. And yes, if you're living in a highly polluted area, maybe an air purifier is the way to go, but it is expensive and not everybody can afford that. So those are some of the things we also decided, and we kind of discussed, and also at the local government level, because eventually in the discussions it also came that air pollution is also a local problem, so it has to be addressed at the ward committee level. So because public health is a function of the ward committee, so that is where one needs to engage a lot more if we have to address this. Over to Kirti now to ask a question, but if anybody wants to add more to Kirti Moni's question, please go ahead. In the meantime, Kirti can ask her question. Over to you.
Good evening. So I would like to know about the pollution which is caused due to the religious activities. For example, Diwali, I think we didn't discuss that. In case if you're trying to ban, say, fireworks or something, people do not think that it is actually trying a mitigation mechanism for pollution, but it is an activity which is probably hindering their religious activities or something. So the attitudinal issues, how does one handle that? And second thing is right to environment should also be backed by duty to keep the environment clean. I believe it's not only about seeking the right, but also about the duty to keep it clean. Yeah, that's it.
Thank you, Kirti. Who would like to take it? Xiaopling, Sharath, Leo.
I mean, if Sharath is Xiaopling,
I don't know if I can be talking about behavioral science, but generally speaking, from the science perspective, we can say that anything that burns is not good for health, whether it's petrol, gas, waste, coal, or even fireworks. So from that perspective, we basically say that avoid as much burning as possible. And the messages that were sent out even during Diwali or even the wedding season are basically that we can't stop it, but if we can avoid even 50% of it, that's a big benefit for us. So there is a lot of behavioral psyche that needs to be worked on. I think that's where the public awareness campaigns will come into picture.
Yeah, I totally agree. I think fireworks is a really big issue because I mean, I think many countries like in Malaysia and in China, and China is an example because Chinese New Year, the Lunar New Year celebration is 15 days. It used to be you start on New Year's Eve and you start doing this huge, and I mean, they're huge, they're massive. It's like being in a war zone. I've never experienced anything like that. And in Malaysia, we have a lot of fireworks. We have it for Diwali, we have it for, Chinese New Year, and now we have it for everything. But in many countries, they actually banned it, but they banned it really with a lot of information giving to people that it is actually very polluting. And when it's so massive, you don't need to give people scientific data. You can actually, you're breathing it, you can. And also the other thing is it's also a hazard because when there's so much of these fireworks, you always have fires, right? And people injure themselves. So for years, we used to have those problems in Malaysia, in the rural areas, in the towns. So finally, the government actually banned it for a long time. And then they brought it back, and the repercussions were, at least in some places, were not actually as negative as you thought it would be, because you have to explain when you do something like that. I think it's really about getting the explanation out there, and I think all of us have to do our part to educate. In China, which is kind of holy grail to do these fireworks, they banned them, and for a long time they had no fireworks because the lunar year is in the winter. And that is about the worst time you want to be doing all this, fireworks. So they're not even fireworks, they're basically explosions, that go on and on and on and on for the whole night. So they basically banned, and then eventually when they allowed it back, when the air quality was much better overall, they did it only on certain days, for certain times, but in some countries, it's still banned. But it's something that you need to sort of educate the public, why it's important to do that.
Thank you, Chokling. There's a question from Dr. Meera Shiva. Meera, would you like to ask the question yourself? Yeah, Meera, go ahead.
It is about the Bhopal gas tragedy, and because certain gases are more toxic, more poisonous. So, like the dust and the petrol, diesel, and the pesticide, fertilizer, many of these things are bad. But like the Bhopal gas tragedy, the methanol society, and other gases, the Bhopal gas victims never got justice. And the recent Supreme Court think that they were not asked Dow Chemicals for any good wrong, The point is that time the number of deaths that took place and the number of people who were injured was a gross underestimate. So over the time, there were large number, documented, and the younger generation, the children born with birth defects, they never got justice. So now, like Dr. David, Mr. David was saying about, putting a face to what happens. That if Bhopal gas tragedy and that what poisonous gases and poisonous air can do, if it cannot move people, I will wonder. So I wanted to know your views, your opinion about this, about is the need poisonous air and toxic fumes, like spraying of the pesticides and all, different than the dust and some of the other air polluting. And all still have a different. This is something that
I was not able to hear it clearly. It's maybe my internet, but hopefully Chokling, Leo, Sharath, if you all heard it, whoever wants to respond to that, please.
So I think we kind of got a sense of what Meera was saying. Yeah, I mean, it's not just appalling, but it's shocking that more recently the Supreme Court has basically put a permanent lid on any way of compensating the victims of the Bhopal gas crime. It is not a tragedy, in my opinion. It is probably one of the most astonishing crimes which has never been punished. If it is punished, it is really marginal. They just got a rap on their knuckles for something as serious as that. Now, that said, I think if you look at most of the environmental cases that we have, it's only recently, at least in India, that we seem to have some sort of effort to go after the polluters with some, at least the NGT's decisions are, in some of the decisions, they go after them and try to get some sort of message across that we can pollute and get it. But just today, there is a decision of the Indian Supreme Court by Chief Justice Chandrachud, in which the prayer to stop the waste to energy plant which has been polluting in Delhi was just sort of brushed aside. If anyone has gone to Delhi and seen the Okla plant, it's evident how dangerous and how serious the impact is on local people. So when we have extremely articulate judges who are also hesitating to take the clear, correct action, I think it is also indicative of the fact that they're not understanding the seriousness of what we are saying. So how do we drive home this point? I think there is also, in my view, a serious lacuna in the way in which civil society and research organizations are communicating the issue. For instance, most of the clean air campaigns are pegged on AQI data. They're not pegged on the actual suffering. Like David said, it is very critical for us to put a face to a problem, and not just one child's face, but there are thousands of children like that who are suffering. And we need to, and it's not to say, look, they're suffering, so you pay some money and you'll get it done, but to try and find budgetary allocations in a serious way to tackle the fundamental problems, fundamental reasons why we have the situation. We are not even making any headway in that direction. In fact, we're going the other way. At least the Indian situation is such. For those who are familiar, I think almost all of our environmental laws are being fundamentally diluted. And as a result, I think it will take us years, if not decades, to reverse that. So there needs to be a convergence, I think, across the board amongst the research community, amongst the civil societies, both national and international, that we will not advocate superficial ideas and superficial solutions. The problem is really serious. And we will also go after some absolutely ridiculous propositions like, what Sharath said, the old scrubbers that are being tall towers. So, they're politically smart responses, politically clever responses, but we know they actually take away critical resources away from being invested in a serious thing. So there are, obviously in a webinar, you can't go into all the details, but I think the broader picture is that we actually need to sensitize critical spaces, the judiciary, the senior bureaucracy. When I heard Randeep speak, I felt like, that's the kind of language we want to hear from the Ministry of Environment and Forests executive, and probably across every state government. So I think that transition has to take place rather quickly.
So thank you, Leo. I saw Mr. Vasant's hand raised a couple of times. Mr. Vasant, would you like to ask your question?
Yes, thank you, Leo and Bhargavi. You are doing a great job. Public related issues being debated in open digital area. I heard just now Sharath telling me that anything burning is dangerous to the environment. So I'm talking about billions of cigarettes being burned every minute. So that means every time you light a cigarette, the lighter burns, the cigarette burns for 5 minutes. It exudes how many thousands and millions of tons of carbon and other gases. Nearly 7,000 chemicals are burned. And it also, smokers are aggravating the NCDs of non-smokers. Is it fair on the part of government to play double standards in controlling tobacco cultivation, manufacturing, distribution? On the one hand, they are levying taxes. and they are becoming what you call perpetrators of murders. They know pretty well that tobacco kills. Why not ban tobacco like polio? Eradicate tobacco from polio, like polio. What is happening is FCTC protocol clearly lays guidelines that you will have to adopt Article 17, Guideline 17, to help farmers to grow alternate crops of in lieu of tobacco, and also cut down enough greenery that is being destroyed for curing tobacco. This is not a small amount. When we are not having enough fresh air and oxygen to smoke, to breathe, government allowing tobacco to be grown in good measure by subsidizing, and also procuring illegal tobacco for auction in government places. Is it not double standard? Why should such a thing happen? I've been fighting and I've been educating farmers that it is a sin crop. Actually, government is levying money, taxes, and also it is Article 299 to 302 of IPC, culpable homicide not amounting to murder. Can I charge government on this account? I'll be happy if I'm given to understand. There, I actually went for a public interest litigation, 55697. I repeat, 55697 of 2014 on abolition of subsidy being given to tobacco growers. The order was passed on 1/6/2015. Till now, no meeting has been held, no orders have been passed by all the perpetrators of supplying legal and illegal tobacco products to the people. Is it fair on the part of government to play such games with the help of people? Health secretary idara illa. Anyway, health department is fighting for curing cancer of people. So agriculture department is helping growers to grow more. And industries and commerce department is exporting tobacco and earning foreign exchange. What is this tamasha, sir? Please.
We got a sense of your long question. Who would like to respond to that? And then we could probably wrap up. Anybody would like to respond to that?
I think
I sympathize with the efforts, but sorry, I sympathize with the efforts, but I'm not qualified to answer that. But I would like to share one story though. When the new continuous monitoring stations were being set up in all the cities, in one of the cities, we were tracking the data in real time, and almost every day, exactly at like 10:30, CO just spikes up. To tremendous amount of 70,000 micrograms per meter cube, but exactly at 10:30 every day. And it used to basically like baffle us. It's not like the instrument is wrong. If the instrument is wrong, then the numbers will be spiking up everywhere. Then we had to ask a student to go there. We know where the station was. So just stand there from 10 to 11 and see what happens between 10 to 11 at that station. And then we noticed that the guard basically goes behind the continuous monitoring station box, and it's a big box. He basically stands behind the box and smokes. And the inlet for the monitoring station is right on top, and then the smoke basically just goes up, and then we see a big spike for that 5-10 minutes. And we caught that. That's the only anecdote I have for smoking. Generally, smoking is bad. We have to avoid that at all circumstances. But I think beyond that, I don't know much to talk about it actually.
Maybe I can chip in, not on the air pollution part because we haven't monitored that, but you can think about it. I totally agree. I mean, smoking is classic, right? Because actually, all those particulates are going straight into your lungs. I just want to share very quickly, because in Malaysia, we're in the middle of a big fight because our last government, we've had so many different governments, unusually for Malaysia in the last 5 years, but our last health minister was determined. And this is a campaign that we have quite a large, for a small country, we have a large platform of physicians, consumer groups, women's rights groups. We've been fighting, against. We have always wanted to ban smoking, and now vaping. Vaping is such a killer, and it's targeting young children. So we actually had a minister, who was there until last year, who put a bill, and this is something the Ministry of Health wanted to do for a long time, but they didn't have a political, minister who was willing to take this up. So we had a bill that was going, and it got cabinet approval. It was tabled to basically do the generational end game, that we would ban vaping and smoking, all forms, for all young people born on the 1st of January 2000 and something, right? They'll hit 18 last year or this year. And then we have very, very strict, we're going to introduce very strict regulations and basically phase it out. Of course, it had tremendous opposition from the tobacco industry. And also, if you want to ban things, you need to actually have enforcement powers. And that would mean increasing a lot of, raiding of places, etc., criminal powers, because you need to enforce something you have banned. And in a period where there was very low trust in the government, we had COVID lockdowns. So you had a lot of parliamentarians led by many politicians who today are in the current government to say this law would be draconian because it was going to give more powers to the state to abuse in the name of public health. So that kind of debate actually then really shrouded the hardcore data, that the economic cost of smoking and vaping is so high. And we have people in hospitals today, in ventilators because of smoking, right? Then this whole thing about a tax. We just, on the 1st of April, issued a tax on liquid nicotine. And the government actually went over the Ministry of Health objections to make them legalize liquid nicotine so that they can tilt the tax. And the tax is not a huge sin tax, it's small. So it's a big fight. This is going on right now in Malaysia. And I think this is an example to show something that is so obvious. There's no doubt about the science. There's no doubt about the medical impact. But the forces and the vested interests are so strong. And also the kind of perception that, because when we want to talk about polluter pays in the real sense, you actually have to have criminalization and enforcement. But when you don't trust the state, you won't support a law like that. This is what we found out in our experience last year, which is very interesting, right? So I just want to throw that in because we are not giving up. We are still going for a ban, and we will continue fighting it. We have a huge protest against the tax, et cetera, right? Thank you.
Thank you, Chokli.
Glad to hear. One minute.
Can I just add a point, Vasant?
Leo, go ahead.
Intervention. You mentioned about political intervention, but in India, every MP is very friendly with tobacco industry because it gives lots of donations, and also in public also they keep on telling the tobacco growers, so long as I am your MP, don't worry, you continue to grow, I will get you good money. When they
you will have that in every country. I mean, we had a minister in the last government whose some of his closest advisors were working in the industry. So we will have that. I think the fight is going to have to go on and on.
I want to say about this that it's.
Thank you, Leo. Thank you.
Yeah, thank you. The point is that when you look at it from a regulatory perspective and from a legal and policy perspective, there have been efforts in India to actually go after tobacco as not just a public health disaster, but also as a polluting unit overall. Anbumani Ramdas was the Union Minister of Health. When we piloted some schemes against tobacco, he quickly lost his central portfolio. Later on, Public Health Foundation for India went after the tobacco lobby, and it is rumored that they lost their Foreign Contribution Regulation Act clearance because of that. The reason why I'm highlighting these is that the lobby is strong, but the way in which the tobacco lobby works is also a textbook case of how the corporate sector, which makes money out of causing ill health, then it also makes money out of treating that ill health. Like if you see the medical industry now, it really, and then the insurance sector. So if people can see the interconnectedness of how capitalism as a system actually makes money out of first putting in misery, be it through air pollution or through smoking or whatever else, and then it actually makes more money out of your misery, right? So the third point I want to make is that, and this needs a lot of alert thinking, and it has to be talked about openly and clearly in local governments, in state governments, in national governments, in international fora. And we can't take our eyes off this type of collapse of, focus on good health, on right to clean air and so on. The third major problem I wanted to share is that India has criminal jurisprudence as the foundation of environmental regulation and also public health. But the current government is actually diluting it. And this is not something recent. It was a move that the US Justice Department piloted 20 years ago by giving a $20 million grant to the Indian government to take our senior bureaucrats, to take our senior policy analysts, and to take our judges as well to the United States and train them on why we should not have our environmental regulation systems based on criminal jurisprudence and instead move towards civil remedies. Now, what it means is that in future, and that law, of course, we fought against that 15 years ago, exposed it, and pushed back against the Indian Ministry of Environment signing on it. But there are many NGOs which are actually supporting that kind of thing in Delhi, in Bangalore, and so on. And some of them are international NGOs who are actually saying, you know what, it would actually help in remedying the situation quicker. But the problem is very simple. When a criminal law doesn't punish you, you think civil law punishes anybody in India? I mean, look at the number of fines people have to pay, and they don't pay anyway. And our judicial delays are such that even the fines will never come. I really don't know if any of the people who have been fined in the last 5 or 10 years of many NGT tribunal decisions have actually put the money down. So yeah. I think going to jail potentially is a very serious fear, and that fear needs to be there. It should not just be palpable, but it should be real. And we have only then I think we will have cleaner air, better health, and a good world to live in.
Thank you, Leo. And I think we'll thank all our speakers for their excellent and very insightful, thought-provoking data, information, and ideas that were shared. But any closing thoughts from Sharath and Chokling are welcome. Before we close, we have a minute more.
Thank both. I would like to thank Leo and Bhargavi for putting this together. Thank you. The closing thing is, I think we mentioned multiple times, we need a better track on environmental education. That's lot more doable than the next one is on the more technical side, having more resources allocated for building a better data-centric understanding of the whole problem.
Thank you. Chokling, a closing thought from you?
Well, first of all, thank you so much. I've learned so much more, like a fast track catch up on the Indian situation. So thank you. It's really great to just learn so much tonight. I just had a closing thought that because David was in the discussion and given some of the challenges in the current government, the dilution, which means a lot of gaps, right, in realizing the right to clean environment, right to health, all the different rights, which I recognize. And despite India's abstaining is the most recent one for the right to environment implementation, right? But India has been party and had not objected to all the different rights. So I think it might be interesting to consider, getting somebody like David or other related, at least on clean air, to come into the country. In fact, maybe when he left, he said he hopes to be in India next year. Because they do consultations and dialogues. They can do a report. They can identify the gaps. So it could be one way to pull together all this data and challenges to sort of say, an extra level, I think, of convening also, within the umbrella of rights. that might be something interesting to consider. And on education, I think that sometimes we think, if we rely only on the formal system, we run into a lot of frustration, But so the education is, I think, across the board, all of us need to do, but we have to learn first before we can try and spread the information.
Yeah. Thank you.
It can be very formidable. So thank you so much to everybody. And I'm very honored to have been able to share this evening with you. Thank you.
Thank you, Chok Ling, and thank you, Sharat, for your time. I know it's really late. Again, thanks to all our participants. Thanks to my colleague Amrita, Nidhi, and Sachin. And have a great good night. Bye-bye. Thanks, everybody.
Thank you, Bhargavi, for doing it also well again.
And please send you all the reports and follow up on our Twitter and reshare it, retweet it. Yeah.
Thank you, Bhargavi. Thanks, Leo, and the whole team. Bye.
Bye-bye.